Hi, and welcome to the Little by Little podcast. I'm Priyanka, and today we're talking about my favorite topic. We're talking about baby making and fertility treatments. I say my favorite topic because this has been a topic of discussion in my life personally for a very long time. Gratefully, it's over. But I know many people out there who are maybe wanting to seek more information about this and some of the girls out there who are probably struggling. Here we have with us today two doctors, Aditi and Amrita, who are fertility specialists, and they're here to guide us on basic topics which are egg freezing, and the most important topic, which is different fertility treatments for different people who have different problems. Every human being is different, and you seek help as per what your need is. The goal is the same, but the line of treatment may vary from patient to patient. Thank you for joining us, Aditi and Amrita. Um,
Thank you for
I
having
I'm
me. Yeah.
I'm really grateful that you said yes, and I keep meeting people who are probably trying to conceive, who are, sometimes I feel like a lot of people are lost, and a lot of people have this misconception in today's day and age where, we do have our careers in place and everyone is ambitious, but a lot of people say, oh, we're putting this baby making to a little later, and kuch nahi to IVF hai. And it irritates me. And the reason I'm starting with this topic is because I feel like a lot of people think it's like, crocin. You just have it and you'll have a baby. 90% of the people I speak to have absolutely no idea what IVF truly is. And a lot of women out there have absolutely no idea that if you don't have a partner and you want to have children, and that's a clear like thought and goal in your head, then egg freezing is something that they must consider. And I feel like when I talk about it, I'm not a professional. So having you both on board to talk about this and guide us, medically, what the right procedure is, what the right process is, would truly be very insightful to all our listeners and all our viewers. So, my first question is, what is egg freezing?
Hi, Priyanka. Thanks for having us, and super excited about this discussion. It's close to my heart as well. So before we dive into what egg freezing is, let's maybe get a background.
Yeah.
What do you think is the most commonest question that is asked to a woman that reaches a certain age? Um, what do you think is asked to her?
When are
शादी
you
कब
having
करोगे?
babies? When are you getting
शादी
married?
first is शादी कब करने वाले हो, and then will be if they're already married, बच्चा कब करने वाले हो. And this is because yeah, everyone is aware that women are born with a fixed number of eggs, which is genetically determined, and it is going to be exhausted at a certain point in time, and that's when a woman reaches menopause and the periods stop, right? So, obviously, women don't want to be bogged down by this question. And in today's day and age, everyone wants to have a career, and nobody's really thinking of having a child maybe in their 20s or even early 30s, you know. So, and why not have it both?
Yeah,
Why, why not, why freeze your dreams? You can freeze your eggs, you know. So, which is why if you see like a lot of celebrities have gone ahead and done this. I think Dinah Hayden is probably somebody who was one of the first celebrities who set an example for young ambitious women. She froze her eggs in her mid-30s, and she went ahead and had a baby 8 years after she froze her eggs in when she was 42. And
correct.
then she had with her frozen eggs at when she was 34. And she went ahead and had two more babies. She had twins 2 years after that,
Correct.
you know. And so this is basically, it doesn't just sound fascinating. It's actually a possibility because of the advancements that, technology has made in the field of reproductive medicine. And so many women have just not found the right partner, and they don't want to, they don't want to rush into anything just because their biological clock is ticking. So this is definitely a great option for them, egg freezing, to do things on their own timeline when they are ready. Um, yeah, I think it's a
And
great,
also, and also a lot of people think this is only for celebrities, when
yeah,
actually it is something for the common man, and actually it
absolutely,
helps you because, well, celebrities can afford a lot in their lifestyle, but as maybe not like, we like people who are in their own career path and are not born maybe with a silver
absolutely,
spoon. You need to be financially independent and stable to sustain a child. Education is so
absolutely,
expensive, so you need to be ready to have a child, which is why
absolutely.
it's okay to, like, push it when you're ready. And for that, we have our egg
Absolutely. So,
freezing.
Isha Gupta, we just heard that she did it in 2017, and she mentions that it was very expensive back then. So, currently, it's not just affordable. It is also very standardized, very, the protocols are very safe as well. So,
Correct.
it's not just about the procedure which has become affordable, it has also become more standardized and safe.
That's true. So,
Yeah,
so
I
what?
like to call it the fertility insurance.
Yeah, but surprisingly, there is no insurance for fertility treatments, right? Like, does insurance cover it?
So,
It's interesting that you asked that. And I'm so glad that you brought it up. Insurance at the moment does not cover it.
it's not a
Yeah, it's
necessity,
not a disease.
not a
It's not a
disease.
disease, yeah.
Not a disease that needs to be cured, but this is so untrue because so many couples are suffering from subfertility, infertility, and they need various forms of treatment, and it's unfortunate that insurance does not
Doesn't
cover.
cover. Yeah, and I
Absolutely.
like I personally feel like it's, but you must treat it like it may be not a disease, but like you go to a doctor for a cold or a cough, and you go to a doctor for some, like, a fertility treatment.
Treatment, yeah,
Absolutely.
absolutely, yeah,
You need to just
yeah.
solve the problem, and there's, like, science has furthered and advanced so much that I think, I hope our country makes a little leeway for couples.
Yeah,
Otherwise it just sounds like a fancy dream sometimes, because at the end of the day, money is money, and to each their own and how they want to spend it. But sometimes, I think having a baby is such a blessing. I feel like there are so many other horrible things people do. This is such a nice thing, and I feel like people should just support, you know, a young couple or an older couple or any aged couple
absolutely.
who wants to have a baby. You're bringing life into this earth. It's probably the most beautiful thing that can happen to anyone.
Fortunately, in India, if you see, none of these government hospitals have IVF as a treatment option. So, where do the people who cannot afford forget, they can't even afford to get an insurance? How will they afford an IVF treatment? So, it should be made affordable to all. I would say, not just, being covered by insurance, but also being given as a free treatment
Free
by
treatment.
the government because it's so much
Absolutely.
required amongst money. It's not just somebody in an upper class who wishes to have a child later, like I said, who wants to do an IVF by choice. It's not so. There are young couples who may need IVF for so many different reasons.
Reasons, yes.
So hopefully, it's for the better. And maybe
Yeah, I
someone
feel,
listening to this
Hopefully, the next
podcast
time we have
decides,
this
yeah,
conversation,
yeah,
correct.
we might have
yeah,
some insurance companies covering.
Yeah, I also feel
Yeah.
like the more we talk about it, the more people become
yes,
aware about it, and then it becomes a conversation maybe in someone else's office, and maybe some reforms are made, and someone will benefit from this.
Yes, absolutely.
absolutely.
So coming back to egg freezing, what is egg freezing? And like, maybe if you could explain a little more in detail, but like if you could try and use terms that, like, the general public would understand, because sometimes it becomes a little like, "Ooh, what is that?"
Right.
Yeah.
So see, egg freezing is basically, to say it in very layman terms, it's like removing the eggs from the ovaries and freezing them outside, right? So this outside is basically it's by a process called as vitrification and cryopreservation of the eggs. It is done in liquid nitrogen, which are mostly present in most of the IVF centers and IVF labs. So, what we do is, typically these women, they need to come in during their periods, like the first or the second day of the periods, and we give injections. These are hormonal injections. If people have undergone treatments of IVF, they would know that, recombinant FSH or HMG, these are hormonal injections which are present in our body, which are released by our brain, but they are given in a higher dose so as to stimulate multiple follicles to develop in the ovaries. So, in a given cycle, in a given menstrual cycle, only one follicle develops. This ovulates. If a couple intending to have a pregnancy has intercourse at the time, may conceive, you know, because of the release of this egg from the ovary, and sperm travels through the uterus, it travels through the fallopian tube, it reaches the egg and it fertilizes the egg. So now well, what we do in IVF, or when we stimulate the ovaries, is we promote multifollicular development. So we give a higher dose of these injections. So we aim promote the growth of all the follicles that are present at that time in the ovary. And then uh, following this, when the we monitor this by doing frequent follicular ultrasounds. So you would have to come into the clinic to get your follicular tracking done by ultrasounds. And once these follicles reach a certain size, we give this last injection for the final maturation of the oocytes. And then the main procedure of oocyte oocyte pickup
Okay.
is done under general anesthesia. And this is via transvaginal ultrasound. We put in a small needle through the vagina, and the each of these follicles, the fluid from the follicles is aspirated, and then this is given to the embryologist in the lab. So the typically, if you see the setup of an IVF OT, the IVF OT and the lab is side by side. So at the same time of the follicle aspiration, this fluid is given to the embryologist. The embryologist will then screen under his or her microscope to see if there are oocytes retrieved from these follicles. So typically, one follicle will have one egg. Ideally, it should have one egg. So egg, so once we have all these eggs, so in a given cycle, we may get n number of eggs. Now, this number of eggs is very important, and this mainly depends on the age of the woman, on the ovarian reserve of the woman, which is pre-tested by the AMH levels that we see. So some women who are older or who have a low AMH, we may get lesser number of eggs, whereas some women who are younger, like say 25, 26, or they have a higher AMH, we get a higher number of eggs. So the egg number, egg quality matters. Now the whatever eggs we retrieve from that one cycle, they are all put in cryo cans and they are then frozen in time. So to say that if you have frozen your eggs today, then if you were to use your eggs, say 5 years later, when you want to use them for, to get pregnant, they will be frozen in time and they would be of the age when you froze them.
Okay.
Yeah. So they don't.
And so, what is the timeline for this? Like, when you say like they'll be frozen forever in time, how long can you freeze these eggs?
So actually speaking, they can be frozen for however long you want. There is no time limit to on how long you should freeze them. They can be stored for however long you want them. But because of the ART now that has come out in India, which is quite stringent in its rules and regulations, they have said that we should not store any gametes, which is eggs, embryos, or sperms, over 10 years. So in India, they say 10 years is what is the maximum, time permissible for freezing of eggs and embryos.
Okay, I just wanted to add one more thing. So think of when you're talking of egg freezing, think of the ovaries like a big balloon and the follicles inside the big balloon as small balloons. So, each of these small balloons have an egg. So when we are retrieving them, we are basically puncturing these balloons, taking the fluid out and freezing the eggs.
Correct. So I have a
Yeah.
question. Now, this egg freezing is done under, like, is it a painful procedure?
It's absolutely not painful. Of course, it's a procedure done under anesthesia. So you don't feel a thing. And in fact, even post the procedure, there is absolutely no pain. You don't even need to take a painkiller post the procedure. It is that painless a procedure.
Okay. And how many times is it safe for you to go through this entire process of egg freezing? Uh, I like just for all our viewers to know that egg freezing is the first step for any kind of fertility treatment that you're doing in terms of IVF.
Yeah.
We start with an egg freezing or an egg pickup, and then you go ahead and you decide what your course of action is with your eggs and your follicles. However, my question is, every time you do an egg pickup, you need to go through the process of injecting yourself with the hormones and whatever your cycle of medication is as prescribed by the fertility doctor, the gynecologist. So, how many times do you think it's safe to do an egg pickup in one person's lifetime?
So basically, it will depend on how many times it is needed, you know, or if the and this will depend on the AMH, which is a blood test which tells us what the egg reserve is like. So the AMH basically tells us how soon the eggs should be, the procedure should be done, how many times we may need to do it, whether if the AMH is low, if the egg reserve is low, we may need to do it more than once. And also it gives us an idea of how many eggs we can expect when we do the procedure, right? So how many times it is needed will be dependent on the age and the AMH. Um, so if the AMH is low, we may need to do it more than once, which could be either two times or three times or even four times. So there is no limit as to how many times you can do an IVF cycle. Some, you might see some couples who have even done 6 IVF cycles. So there is no upper limit as such, but basically it will depend on how many times it is needed to be done. And finally, we are looking at the outcome, right? We want to give couple a healthy baby. So, and it is not, and it's not unsafe to do it, more than one time. If that answers you.
And just
Yeah.
give a number when you're talking about egg freezing. Like when we're doing IVF in a couple, we do the IVF, we may do the transfer, and suppose it fails and we don't have any more embryos, then the couple would have to undergo another cycle. But when it comes to egg freezing, of course, these eggs are going to be used much later, so we don't know if these eggs will, survive the process of thawing, fertilization, etc. So to get one healthy baby from eggs that you have frozen, you need to have at least 12 to 15 eggs that would be frozen. So now in one cycle, if your AMH is not optimal, we may not get those many eggs. So we may have to do 2 cycles of the whole process to get the desired number. So if you have good 12 to 15 oocytes frozen, you can expect to have one live birth. So that's the ratio.
Got it.
Yeah.
And and what is the entire cycle of one round of egg freezing? Like you said you come when you start on your period. So like approximately how many days would it take?
So typically it would take about 15 to 16 days in a woman who has regular periods, who's ovulating every month. Sometimes these injections may have to be given for a longer time. So I think maximum 3 weeks from the start of the period cycle.
Okay. And these usually will be with, hopefully in a cycle where you said you like a regular woman who's ovulating and all of that. Does do women who have PCOS and PCOD have a different cycle for egg freezing? How does
They
you have
don't
to?
have a different cycle for egg freezing. They may need longer periods of stimulation for those eggs to become the size that we require to finally give that last injection for the final maturation of oocyte. So typically, PCOS women we see take the follicles take longer to grow in size. So they may need like so typically if you see in all women they would take need about 10 to 12 injections starting from the first day. In PCOS women, they may need about 14, 15 that way.
Got it.
Yeah.
Okay.
Yeah. And
Okay.
we also get a higher number of eggs from PCOS women because they're larger, they have multiple follicles. So, that's the other thing about PCOS.
Yeah. But
Yeah.
then when you say multiple follicles, is that more favorable for one round of egg freezing?
In a way, it is, but it can also be slightly risky. It can cause this issue called as ovarian hyperstimulation syndrome. But nowadays, the IVF practices and the hormones and everything that we give are so safe that OHSS is practically not seen in the current scenario because the injection that we give, we don't give HCG as a trigger, we give the agonist as the trigger. And this practically, it we don't see any cases of OHSS anymore. So it is safe. I would love to say that PCOS women, more number of follicles, better number of eggs, but sometimes their quality of eggs is little hampered. So I wouldn't like go out and say that if you get 20 eggs, that's great because they may not all be of good quality.
Got it. And the quality of these eggs are known before you freeze them?
When we see the oocytes, we do know the quality of eggs.
Okay.
At least we will know the maturity, whether they're M2, M1, or the very, immature GV ones. That we will know, and but the quality of eggs will mostly, I mean, it only seen or understood after we fertilize the eggs whether after we see that okay now they have fertilized on day 1 or they go to day 3 or day 5, when
Fine.
they the blastocyst, then we know okay these were good quality eggs. But yes, to some extent even on the morphology on how they look under the microscope we can make out the quality.
Perfect. Does this the entire cycle of egg freezing hurt you physically? The injections, are they like the age-old injections, or are these all like subcutaneous that you can take? Because whatever videos you see on YouTube, mostly they're white women. They just pull up their t-shirt and like pinch their stomach and just inject it themselves.
Yeah, they're basically subcutaneous injections, like you mentioned, and typically they are not very painful. And in fact, yes, they can be self taken, but if for whatever reason anybody is not comfortable with it, then of course you can, you have the option of going to your fertility clinic and having it uh, given to you. But they are subcutaneous injections and they are very similar to insulin. And, yeah, insulin is basically self-administered by whoever is taking it. So they're not very painful.
The next question I have is, can I transfer these eggs to another country or another hospital? How does it work? Like, if I do my egg freezing in one center, and maybe like, you get married and you move elsewhere and your eggs are frozen in another hospital, does do these transfers happen seamlessly, or like, is there a legal procedure to move it from one hospital to another because it's genetic material? How does
Yeah.
that work?
So basically, the ART law, which is in place, it prevents the use, sale, and transfer of any gametes or embryos from one place to the other, except if they are for self-use. And of course, this is for self-use. And this is for transferring it either within the country or even outside of the country. But if it has to be done, then yes, it is possible. The only thing that you need to do is you will need a permission from the national board And it will be a process. It will be a process that will probably require 4 to 6 months. You will need an advocate also to help you with the intricacies. So it's not like it's not possible. It is definitely possible and it is allowed. But you need to follow the due protocols, and you need permission from the national board.
Got it. Uh, Now that we know what egg freezing is, let's move to fertility treatments. What are your options if you don't conceive naturally? Let's take one step back and let me ask you one question before this. What is the most appropriate time to come and see a doctor? If like when do you realize that okay, this is not happening and now I need help? So when is the right time to actually, make that phone call, take that appointment and say, Doc, I have a problem. Something's not happening, or I'm like, are we doing something wrong?
Let's understand physiology, okay? In a normal menstrual cycle, a woman is expected to ovulate, right? But the possibility of a couple conceiving in one cycle, everything being normal, if you consider that everything is normal, if you assume rather that everything is normal, what is the possibility of a couple conceiving in one menstrual cycle? It is just 7 to 10%. People think that okay, if they've tried in the fertile window, then they will conceive, and everyone panics and comes to you saying that, oh
Yeah,
doc, I've tried this cycle and I haven't conceived. What is going on? So it's just 7 to 10%, and cumulatively over a year, if uh, if everything is normal, a couple is expected to conceive, right? But if they are unable to conceive after regular unprotected sex for a year, that is what is the definition of
definition of.
infertility. Yeah.
Got it.
But for someone, if the woman is less than 36 years of age, waiting for a year, we would be doing a great disservice to her. We will be losing out on very precious time. So we don't want to obviously wait for 1 year. We will reduce this time frame to 6 months. But so yeah, 6 months to 1 year. That is when you will go to a fertility doctor saying that I have been trying, but I'm not able to conceive. But having said that, if you've already done certain tests, and if there is something which is not normal on those tests, which will tell you that you may not be able to conceive. Of course, your doctor will be able to tell you why and if there is a problem. But if that is so, then definitely you need to go see a fertility doctor sooner.